This conversation around AI and machine learning can't find a better home, and there's no better representation than what we're about to see that's been developed over the last couple of years, a product called Medikarma. And again, something that HITLAB is in the middle of testing, and really excited to show you and provide you some examples of what's going on and how it's working. And along those lines, two veteran entrepreneurs in digital health and pioneers in the field. Obviously, you all know Don Jones, who's a regular on the Symposium each month, and you guys know Don and his work going back to the San Diego County digital health ecosystem, really put together with Qualcomm and Qualcomm Wireless back in the late 90s, and then obviously propelled forward with Eric Topol moving to San Diego and joining up with UCSD and Scripps, and then writing The Creative Destruction of Medicine in 2012, which really did help formulate and begin to codify digital health as a really a framework, if you will. And now with Medikarma, we've seen that come together, and really excited to welcome Don Jones, and who's an advisor with Medikarma, and then obviously the founder and the passion behind Medikarma, Kris Narayan, the chairman of Medikarma. Welcome to you both.
Thank you, sir.
Good to see you today, and really looking forward to seeing more about what you're doing and talking through some of what's going on there. And so really, to start it off, Kris, if you could tell me a little bit about what Medikarma is.
Absolutely. So Medikarma, in very simple terms, is a patient engagement platform. It is focused on preventive care. What we are trying to do is to focus on helping you understand your health and take steps every day to improve your health. That is the basic goal. How do we do this? We understand, for you to understand your health, you can't fix what you don't see, and you can't improve what you don't measure. So based on this premise that we need to show you where you are in your life, what is your health conditions, and what are the things that you can fix in a very clear, simple way every day to improve your health. That's what Medikarma is about. So I'm going to show you a picture of what the product is. Let's see if Ashley can screen share.
That's amazing.
So this is a desktop version of the product that you see here. There is also a mobile version. The implementation is simple. As you and I are talking right now, with your consent, I can create an avatar of you. And around this avatar, I go get the latest information about you from your EMR and create a set of cards that represents your health of yourself and your organs. And coming from a consumer point of view, we represent this like a check engine light or traffic light, green, orange, and red. We show you your organ status, and we show you how this different parts of your body, the cardiac risk, diabetic risk, kidney risk. Basically, we are showing this based on algorithms that we licensed, industry standard algorithms, many of them clinically tested, and we are showing it to you where you are and what is the weakest link in your chain. While this comes across a consumer-oriented product, it's actually a fairly deep data machine. There are 4 streams of data going into this product. The first one is the EMR. Second one is any smart devices you may be using, Apple Watch, Fitbit, Oura Ring, even Peloton Bike or Libre. All these are automatically connected. So we not only know where you are in your health condition, we also know how you're behaving to improve that health every day. So we take that input in. In addition, if you're a chronic patient, we are able to monitor your RPM devices, blood pressure, or any of the vital signs. And finally, we also ask you, how are you doing every day? How did you work out yesterday? What is your diet? How is your sleep? All these data is configured, goes into the platform, and helps create your full profile. And we use this data to create what you see on the right side, a FICO score. So the FICO score for your health. And this is a number, we initially created it. We try to gamify it. You get up in the morning, you look at it like say 7:05. We tell you what you did well in the last few hours or few days and what you didn't do well. Those are called the score drivers. And when you click on any score driver, it tells you what can you do next. Very simple consumer concept. What do I do next in the next 24 hours or 2 days to improve my health? How can I take my score from 700 to say 710? So this entire thing has been put together in production and fully deployed right now with some select patients. And to finish this chain, we realized to make this really a communication platform of this deep data, we created Jill. We have been working on this for last over 2 years. This is our answer to ChatGPT. Jill is a conversational AI. She knows a lot of things about you. She knows your behavior. She knows your health conditions. She knows how your remote patient monitoring is working. She takes all this information to tell you what are the things that you should be doing. So Jill is a full conversation AI that you can ask any questions related to healthcare, and she'll try to answer. And this is a product that will evolve just like most of the products that you see in the market, like Alexa. But our goal right now is to make Jill the primary interface that you can talk to in the morning and make it your health coach. So that's a good summary of the product. If you have any more questions.
That's a great summary of the product. Thank you very much. And talk to me about traction. Obviously, this is really bringing together what everyone's talking about with ChatGPT and Bert from Google and others. What kind of traction are you seeing right now in the ecosystem?
A couple of things. One, I'm going to show you a demo of actually me talking to Jill in a couple of minutes. That can tell you how a conversation happens in real time. In terms of traction, we launched the product and we made several announcements at JPM in 2023, just a couple of months back, right? So we announced one of our first customers, Global Cancer Research Institute, GCRI, where we are actually deploying the product already. And patients are starting to use it. And we are conducting a survey on how often they are using Medikarma, how their monitoring is going on. We monitor their health. And we are able to basically formulate a survey by using so many minutes a day and following their physician's instructions with the proper monitoring. How many minutes are they using? How healthy are they getting based on the vital signs measurements through RPM? And how happy are they feeling as their health improves? We have also been the score. I talked about the score. The score was initially created as a gamified score, just for you and I to drive it from 700 to 800. But interestingly, in the last few months, we came across a payer that got very interested in this product. And they asked us, can you use this score to predict claims data? Who's going to get sick more and what not? So we ran, they brought in 65 million de-identified users into our box. And we ran our score against that. And we were able to basically prove Medikarma health score can correlate to the claims data at 75.6% or more. This is important. The more we are able to predict looking at the data of users, their chronic conditions, their EMR, their current behavior, the more we have an opportunity to predict which of the diseases can get worse and intervene and actually help the patients change their behavior to get healthier. This actually benefits everybody. It benefits the patients, the payers, the providers. Everybody gets benefited by patients getting healthier. So the final traction that I should mention to you is we are starting about 10,000 patient enrollment in Florida. We are basically bringing these folks and putting them on a program to use Medikarma. And our goal is to prove these patients come from some Medicare Advantage and some ACO providers. And our goal is to prove that by using Medikarma, people can actually start seeing improvements in their health, as well as we can make some important cost reductions for the payers and the providers that are actually doing this study. That's the goal. So this program is starting in Broward County as a focus, Palm Beach County, and Dade. And it's going to start around March 1st and carry on to a good conclusion in about 4 months.
Fantastic.
We have a demo of Jill. Yeah, we can show it to you now.
Yeah, please.
Hi, good morning. In the next section, I'm going to talk about our biggest feature, Jill AI. So not only we can create an avatar of you, show you all your health around your body, show you the weakest link, not only we can create a score that can actually measure your progress and kind of predict what kind of claims you're going to file in the next couple of years. The last feature that we reserved is Jill AI. Jill is a coach, health coach. She can pretty much answer to any of your questions, talk to you and tell you what to do about your results, tell you what to do next. The most meaningful question in healthcare that can change your life. What do I do next? So while we've been hearing so much about ChatGPT in the last few months, we've been working on this version of conversational AI for the last 2 years. We created a beautiful, extensive library of all questions and answers, topics you can ask, and we are at a stage where we have launched this product and we are working with consumers to get this better and better as we go. Now I'm going to show you how you can have a conversation with Jill in the morning. When you wake up, let me show you the demo. Hi Jill, good morning.
Hello, I am your virtual health assistant. Ask me common health questions or say, what is my BMI?
Hey Jill, how am I doing today?
Hi Chris, welcome back. It looks like you're making great progress toward your health and wellness goals. Your health score went up by plus 25 points over the last week. Keep up the good work. Do you want to learn more?
Yes.
Your improvement in score is mainly driven by your blood pressure reading decreased to 130/80ths of a millimeter of mercury. Your goal is to get to 120/80ths B, increased GFR score from 60 to 75. I got this information from your recent lab results. Your goal is to get to over 90. You are moving in the right direction. Keep up the good work.
Can you explain what you mean by GFR?
Sure. The glomerular filtration rate GFR is the rate at which blood is filtered by the kidneys. It is a measure of how well the kidneys are functioning and is used to diagnose and monitor kidney disease.
Great. How is my blood pressure tracking?
Your blood pressure reduced from 142/84ths of a millimeter of mercury to 130/80ths. If we can get to below 120/80ths of a millimeter of mercury, your score could increase by another 15 points. I'm going to add a note in your list of questions for your next visit with Dr. Anuj, your primary care physician, to ask if a change in medications might help.
Okay, what do I do next?
Sure, I have drafted a list of personalized recommendations, which you can check by clicking here. Most importantly, it seems like you haven't had a COVID booster shot in over 12 months. Given your past history, I would highly encourage to schedule a booster shot. Would you like me to make an appointment request for you?
Sure.
Great. Based on your availability, I have requested a visit time for Tuesday, the 22nd, in the afternoon at 1 p.m. I will keep you posted once this CVS clinic accepts the request.
Thank you, Jill.
You are welcome. BTW, I have a new notification that your electronic medical record permissions have expired. Below is a video that can guide you through the step-by-step update process. There is no cost to you. Please take care of this urgently so I can be kept up to date and help you continue to improve your health and so we do not miss anything important.
So, there we go. You can carry on a full-blown conversation with Jill and ask any questions. Jill comes in multiple forms. There is a FAQ Jill that gets invoked when you ask questions on how to use this product. There is a static Jill implementation, which answers any of your generic questions. And finally, we do have a dynamic version, which is all about you, your lab results, your smart devices. It can tell you what's going on with your body, and dynamic case explain to you your conditions. So, as we said before, we've been working on this for the last couple of years, and we have put together a product that's fairly versatile, but customized to you. Because as a patient, it's all about me. It's all about my conditions, and what do I do next to fix myself and improve myself every day to achieve the full health I can. So this is our work, and I hope you start using it and you enjoy getting healthier. Thank you.
All right. That is outstanding. What a great demo. And we're getting great comments too in the chat box, Kris, just so you, I don't know if you've been following those, but people are talking about how magical that is and how amazing it is to see that kind of fluidity in a conversation. And also, again, for the audience, just to remind you, Don Jones is here as well, and he's working on this with Kris, and you couldn't ask for two better veterans to be developing a product that is truly something that can improve patient care at a highly scaled level, not just in the US, but around the world. But Don, you've been around digital health now for 3 decades, and being in San Diego County as you are, you've been at the forefront of a lot of this stuff. What, from your standpoint, given the fact that the digital front door is becoming such a common theme with almost every medical practice out there in hospitals as well, health systems, why is this concept, why is the Jill model seeing so much welcome and getting so much praise from the people that Kris is talking to these days?
Yes, Dan, thanks. I think it's two factors that are key. One is that I think almost all of the other applications that are being shown and demonstrated, not only in your own program today, but kind of around the digital health world, are clinician focused, health system focused, health payer focused. They're not consumer focused. And Jill is a consumer focused application. This is about effectively arming the consumer with the information they need, when they need it, how they need it, in a way that's helpful to them. And the other piece that's is frankly, the healthcare system has a lot of friction caused by basically being locked into old analog forms of communication. Basically your doctor's still behind an analog telephone and a fax machine, and not much more in way of how you actually communicate and arrange and or transact services. So there's a lot of friction just added to timeliness and even accessing and transacting in healthcare that just comes from poor communication practices. I mean, frankly, the telecommunications world has moved so far past healthcare practitioners, it's not even really funny anymore. It's actually kind of sad.
That's an understatement for sure. And we're running a little bit behind, so we've got time for one more question. And again, Kris, I wanted to dial you into this to get your feedback on, again, the vision of Jill in the future of the healthcare system. And it looks like Kris might be offline, so let's go to Don on this one. Don, when you look at Jill, and oh, there he is, Kris, as the CEO of Medikarma, what's the future of Jill in the healthcare system?
So my vision is to create a product that everybody finds it so easy to use, and basically results in them, all this anti-aging going on. We want to get the healthiest possible way we can be. So we want to get there. We want to continue to improve the tool. We want Jill to become an everyday household name. And we want to get to a point in which this is very easy to use and easy to integrate in your life. But in terms of call to action for this forum, the product is ready. We are looking to license Medikarma platform to provider networks, to health systems. Either you can use it as is, or you can integrate into your digital front door. And we basically want to spread this so that more and more patients benefit and get healthier.
That's wonderful. Again, Don, Kris, thank you very much for joining us today. Congratulations on developing such an amazing product and platform. Looking forward to seeing and hearing many good things about you in the future. Thank you.
Thank you.
Thank you.